Alrighty, so I've done belly to ball, I've done armpit. Now I'm gonna do deep pressure therapy as you have seen it the most. I'm gonna use this real quick, and then I'm gonna drag in an alternative for deep pressure therapy that I very rarely use, but to get in the habit of. Because this weight's not a lot for me, and I don't think it should be for a lot of you guys, there are thresholds you can meet with it that you couldn't meet with like a 100-pound bag, for example. I'm driving some jaw tension down into it, like the silent scream. I can actively feel a stretch of my sternum from my collarbones being pulled to the back of my skull here. And then the only thing I need to do is get a little more lift from my chest to get the balls pushed into my chin more actively. So my chin and chest are doing this to the ball. I can tell you outright, this fatigues the hell out of my jaw very quickly. That being said, anything that feels overwhelming or feels like you can't do it, I'd play it by ear. Try to do a little bit more than you thought you could. Nice and comfy. I'm starting to feel my upper thorax starting to settle into the ground, getting a little bit deeper into the ground. Something you might notice, guys, my chest is not high enough to make this work yet, but you can see that there's a little bit of that rib flare that happens down at my lower ribs if I'm trying to get tall, because these ribs can externally rotate really well. These ribs, not so much, especially when there's weight on them. But that's what we're trying to do, guys. We're trying to get that rib flare that's down there to translate to external rotation higher up. So in order to grow out your ribs, you actually have to earn taller positions. Not like this, because this is not how we climb shit. It's nice and fun, guys. At the end of the day, if you're doing this and you're trying to focus on, is my form right? Am I getting enough results? Am I whatever, then something is taking you out of the situation or something's preventing you from getting in it. And I would sooner book a session than I would try to figure it out on your own, because all this shit should be fairly unconscious. Like the benefits of a lot of this stuff should be something that you get from a lot of somatic care or like somatic work with more of a muscle benefit, more of a stability benefit that comes after the fact. So this is 40 pounds. I'm going to bring something out that's quite a bit heavier. Just give me a moment because it's kind of hard to move.